Welcome back to our BCBA exam preparation series. In this video, we are going to focus on one of the most important conceptual areas in applied behavior analysis: experimental design. Experimental design is the backbone of behavior analytic research and practice. It is the tool that allows us to demonstrate experimental control and functional relationships between variables. In this session, we will review the major single-case experimental designs used in ABA, the logic of baseline, including prediction, verification, and replication, and most importantly, how experimental design questions appear on the BCBA exam. By the end of this video, you should feel confident identifying which design is appropriate for a given scenario and recognizing the key indicators of experimental control. When you encounter experimental design questions on the BCBA exam, it helps to follow a systematic strategy. First, always ask yourself whether the design demonstrates experimental control. Experimental control means that we can show a functional relationship between the independent variable and the dependent variable. Second, identify the variables in the scenario. The independent variable is the intervention being introduced or manipulated. The dependent variable is the behavior being measured. Third, apply baseline logic. Behavior analysts rely on three key concepts: prediction, verification, or replication. These allow us to determine whether the intervention truly caused the observed behavior change. Finally, match the design to the goal of the study. Different research questions require different experimental designs. A useful exam reminder is that the purpose of experimental design in ABA is always to demonstrate control over behavior. In applied behavior analysis, we typically rely on single-case experimental designs rather than group designs. The most commonly tested designs include: first, single-subject designs, which focus on repeated measurement of an individual's behavior over time. Second, reversal or withdrawal designs, where an intervention is introduced and then removed to observe whether behavior changes accordingly. Third, multiple baseline designs, where the intervention is introduced at different times across subjects, behaviors, or settings. And finally, the changing criterion design, which is used when behavior is gradually shaped through progressive performance criteria. Each of these designs has specific strengths, limitations, and appropriate applications, and understanding these differences is critical for the BCBA exam. Single-subject experimental design is the foundation of research and practice in applied behavior analysis. Unlike traditional group research, ABA focuses on the behavior of an individual organism over time. There are three key components of single-subject design. First is individual focus. The goal is to analyze behavior change within a single participant rather than comparing large groups. Second is repeated measurement. Behavior is measured repeatedly across time so that we can observe patterns, trends, and stability. Third is the baseline intervention comparison. Typically, we begin with a baseline phase, labeled A, where no intervention is introduced. Then we introduce the intervention phase, labeled B. In some cases, the design returns to baseline, creating the classic ABA pattern. Single-subject designs are particularly valuable in applied settings for several reasons. First, they are ideal for individualized interventions. Behavior analysts often work with unique client needs, and single-case designs allow treatment to be tailored to the individual. Second, they allow us to evaluate behavior stability across time. Repeated measurement helps determine whether behavior is stable before introducing intervention. Third, these designs allow for flexible adjustments. Interventions can be modified based on the client's response. One common exam mistake is assuming that single-subject design is similar to group experimental research. In reality, single-case methodology focuses on within-subject analysis rather than between-group comparison. One of the most powerful experimental designs in ABA is the reversal design, also called the withdrawal design. The classic structure is ABA. The first phase, A, represents baseline. The second phase, B, introduces the intervention. The third phase returns to baseline conditions by withdrawing the intervention. If behavior changes when the intervention is introduced and then returns toward baseline levels when the intervention is removed, this provides strong evidence of a functional relationship. Reversal designs are particularly valuable because they produce strong internal validity by demonstrating clear cause and effect relationships. Reversal designs provide clear evidence of functional relationships because they repeatedly demonstrate the effect of introducing and withdrawing an intervention. This makes them one of the strongest designs for establishing experimental control. However, there are important limitations. First are ethical concerns. It may be unethical to withdraw a treatment if the behavior is dangerous or the intervention is highly beneficial. Second is behavior irreversibility. Some behaviors cannot simply be reversed. For example, once a person learns a new skill, removing the intervention does not necessarily eliminate that skill. For exam purposes, remember this key rule. Reversal designs are best suited for behaviors that can realistically increase and decrease across phases. The multiple baseline design is commonly used when reversal designs are not appropriate. Instead of withdrawing treatment, the intervention is introduced at different times across multiple baselines. These baselines may involve different participants, different behaviors, or different settings. The intervention is staggered across these baselines. If behavior change occurs only after the intervention is introduced in each baseline, this provides evidence of experimental control. Importantly, no reversal phase is required, which makes this design ethically preferable in many applied contexts. Multiple baseline designs are particularly useful in several situations. First, when behavior change is irreversible. For example, if the intervention teaches a new skill such as reading or communication, removing the intervention will not undo the learning. Second, when ethical considerations prevent withdrawal of treatment. Third, when researchers want to test generalization across settings or behaviors. By introducing the intervention across different baselines at different times, behavior analysts can demonstrate that the intervention is responsible for the observed behavior change. The changing criterion design is used when behavior change occurs gradually over time. Instead of a single intervention phase, the behavior analyst establishes a series of progressively changing performance criteria. Each phase introduces a new criterion level. For example, if a goal is to increase exercise duration, the criteria might progress from 10 minutes to 20 minutes to 30 minutes. If behavior consistently changes to meet each new criterion level, this provides evidence of experimental control. The key feature of this design is the systematic stepwise change in performance expectations. Changing criterion designs are especially effective for shaping behavior gradually. They allow behavior analysts to set incremental goals, making behavior change more achievable. Because the intervention is never withdrawn, the design also maintains treatment integrity throughout the study. Another advantage is the ability to achieve fine-grained control over behavior change by adjusting the criterion based on performance. For the BCBA exam, remember that changing criterion designs are most appropriate when behavior change should occur progressively rather than immediately. Baseline logic is the conceptual framework that allows behavior analysts to demonstrate experimental control. There are three essential components. First is prediction. Baseline data are used to predict what behavior would look like if no intervention were introduced. Second is verification. Verification confirms that changes in behavior are related to the intervention. Third is replication. Replication involves repeating the effect to ensure the relationship between the intervention and behavior change is reliable. Together, prediction, verification, and replication form the core logic of single-case experimental research. Baseline logic is critical because it provides the scientific foundation for experimental control in ABA. It ensures that behavior change can be attributed to the intervention rather than extraneous variables. Through baseline logic, we can establish a functional relationship, intervention validity, and reliable, replicable results. Without baseline logic, we would not be able to determine whether an intervention truly caused the observed change in behavior. There are several common mistakes that BCBA candidates make when answering experimental design questions. One common error is confusing different types of designs. For example, mixing up reversal designs with multiple baseline designs. Another mistake is misinterpreting baseline data. Before concluding that an intervention caused behavior change, the baseline must demonstrate sufficient stability and predictable trends. Finally, candidates sometimes overlook ethical considerations. Ethics always play a role in selecting an experimental design, especially when withdrawal of treatment may harm the client. On the BCBA exam, experimental design questions typically appear in three formats. First are design selection questions, where you must choose the most appropriate design for a given scenario. Second are questions about strengths and weaknesses of particular designs. Third are data interpretation questions, where you must evaluate whether experimental control has been demonstrated. When analyzing these questions, always begin by identifying the research question, the independent variable, the dependent variable, and any ethical constraints. This systematic approach greatly improves accuracy when answering exam questions. To summarize, the core elements of single-subject experimental design include: first, individual focus; second, repeated measurement of behavior over time; third, baseline intervention comparisons. These components allow behavior analysts to demonstrate experimental control and functional relationships. Single-case methodology is considered the scientific foundation of applied behavior analysis. Sometimes researchers extend reversal designs beyond the basic ABA structure. A common variation is the ABAB design. In this design, the intervention is reintroduced after withdrawal. This provides an additional demonstration of the intervention effect and strengthens the evidence for a causal relationship between the intervention and behavior change. Each reintroduction of the intervention provides another opportunity to demonstrate experimental control. Multiple baseline designs can be implemented in several ways. One option is across subjects, where different participants begin the intervention at different times. Another is across behaviors, where multiple target behaviors are treated sequentially. A third option is across settings, where the intervention is introduced in different environments. In each case, the key feature is staggered implementation of the intervention, which allows the researcher to demonstrate experimental control without withdrawing treatment. When implementing a changing criterion design, several principles must be followed. Criteria should increase gradually and systematically. Each criterion should be achievable so that the participant can demonstrate progress. The changes in criterion must also be based on functional analysis and ongoing performance data. If behavior changes in accordance with each new criterion level, the design demonstrates a functional relationship between the intervention and behavior change. Prediction is the first component of baseline logic. Using baseline data, behavior analysts predict what behavior would look like if no intervention were introduced. For prediction to be reliable, baseline data must be stable and consistent. Once a prediction is established, we compare the predicted behavior to the actual behavior observed during the intervention phase. If behavior changes in a way that differs from the prediction, this suggests that the intervention produced the effect. Verification demonstrates that the change in behavior is related to the introduction of the intervention. This occurs when behavior shifts in a predictable direction after the intervention begins. Data collection during this phase allows the behavior analyst to confirm that the intervention and behavior change are systematically related. Verification is therefore an essential step in establishing experimental control. Replication is the final component of baseline logic. Replication occurs when the effect of an intervention is repeated across phases, subjects, or settings. For example, reversal designs demonstrate replication across phases. Multiple baseline designs demonstrate replication across participants or behaviors. Replication strengthens the evidence that the intervention, and not some external variable, caused the behavior change. Ethical decision-making is an essential component of experimental design. Behavior analysts must always prioritize client welfare over experimental control. Certain behaviors cannot ethically be reversed, particularly if withdrawal of treatment would place the client at risk. Design selection should always consider beneficence, informed consent, and the potential risks of withdrawing intervention. Ethical considerations often guide whether we select reversal designs or multiple baseline designs. When analyzing research data, there are several indicators that experimental control has been established. First, stable baseline data. Second, clear phase changes between baseline and intervention. Third, consistent trends in behavior change that correspond with intervention phases. These indicators allow behavior analysts to determine whether the intervention truly influenced behavior. To master experimental design for the BCBA exam, consistent practice is essential. Make sure you are comfortable with identifying different single-case designs, applying baseline logic, and recognizing experimental control in graphical data. The more practiced scenarios you analyze, the easier it becomes to identify the correct design under exam conditions. So if you want to strengthen your ability to analyze experimental design questions under real exam conditions, we've created full-length BCBA-style mock exams and targeted practice sets specifically designed for this purpose. You can access them at www.bcbmockexam.com. Go check it out and start training your clinical reasoning the same way the actual BCBA exam will test it.